Lauren Dowden for Conduit News, and today we have Dr. Amy Beard joining us again. She's a certified functional medicine physician practicing out of Little Rock. Hi, Dr. Beard.
Good morning, Jenny.
I wanted to get your opinion and your thoughts on a situation that's happening here in Northwest Arkansas. You're familiar with Dr. Karis. He's done exceptional work in treating COVID-19 during this pandemic. And he's also the physician for the Washington County Detention Center. Most recently, it's been reported that 4 inmates are going to be suing him regarding his treatment with ivermectin. First, just what is your first thought that comes to mind when you hear that?
Well, they're alive, so they can sue. That came to the thought, a thought I had there. That there's someone else behind this. We know how political it has become, and we're seeing this right now with what they're doing to him.
It has been said that, and we've talked about this, it is perfectly reasonable for physicians and doctors all of the time to prescribe off-label drugs, especially ones that are safe and FDA approved. Is this situation, in your opinion, any different?
No, we've done this. Doctors do this all the time. Ivermectin has been used for a long time and very safely, over 4 billion doses worldwide. It's one of the safest drugs out there. And we've been using it successfully. There's tons and tons of research and evidence now. There's no disputing that. I guess you could, but with the truth is on our side. And so, again, off-label use, very, very common. And so what he did, I feel, was appropriate. I don't understand the complaint here. Because lots of times, and I guess we have to look at the details of the case and what they're really getting specific about. Or do they have a problem with him administering ivermectin, or the fact that these inmates feel like they did not have informed consent?
Mm-hmm. Right.
And how often does this occur with other medications being administered at that facility?
Right. Exactly. Well, and one thing is like, okay, they didn't know that they were taking ivermectin. And then 2, that, it's being said, well, this is not one of the protocols for treating COVID-19. There is no protocol.
Yeah.
Right. And so why would you not want your doctor to use anything in his arsenal to help you get better? I don't understand that.
Jenny, the past 2 years have made no sense. And so, again, this doesn't make sense either. There's no logic in this. When you approach it, using ivermectin, a very, very safe drug that has been used on millions of people safely and effectively. Where's the crime?
Right. Well, and for anyone who's been following Project Veritas and the work and the documents that they've recently released, we saw the Department of Defense had research, had materials that said in the treatment of this, ivermectin worked. And so, which one is it? Does ivermectin not help? Does it not work? Or is it something that can be used to treat COVID-19? You can't have it both ways.
No, you can't. I believe on the World Health Organization website as well, ivermectin's listed there as well as a treatment.
Right. And what's so frustrating, I think, for a lot of us, we'll see these news articles come out, especially most recently now about the Washington County Detention Center, and the photos that always accompany it are the ivermectin horse paste, not the human drug, but the animal drug. I have no words. What do you think about that?
This is from people who have no other defense, and they're just trying to scare people, confuse people. Continuing to push this narrative just makes you look silly and foolish at this point. We know what's up with that, and there's many drugs that both humans and animals both use.
Right.
Not just ivermectin.
Right. The Arkansas State Medical Board has said that they're going to be opening up a case against Dr. Karis. you have been very open about some times that you have had to go through that as well. People have most recently filed a complaint against you because you are very aggressively treating COVID-19 in a way that I would say, the medical industrial complex doesn't want to happen. Tell us about what this process is going to be like for Dr. Karis, and what to expect.
I'm not sure what their complaint is. Is it really, what's their beef with him prescribing ivermectin? Is it because the inmates did not know what they were getting? If that is the case, it seems to be an issue with the process of how the medicines are distributed and how the patients are informed. Mm-hmm. Perhaps that is not on Dr. Karis, but perhaps the facility. But if they've got a beef with just ivermectin, wow, Dr. Karis is going to have the truth on his side when he presents this to the board.
If you were
able to really want to go there.
Right. Yeah. If you were able to talk to Dr. Karis today or give, any other physician a word of advice as they're, kind of going into this uncharted territory, what would you tell them?
You've got to be on the right side of history. And whenever you see the types of things going on in our profession, this outright censorship, threatening behavior, that never happens by the good guys. Okay. And you can't give into that, because if you do, it's only going to get worse. You have to stand up now. I wish we would have done that a long time ago, but you have to be on the right side of history and opposing and sticking up for yourself in these times and opposing what is not right is the right thing to do. Always. You will never go wrong by doing the right thing.
That's so true.
Not that you won't have to, get some blowback for that, but at least you can sleep good at night.
That's right. That's right. Well, listen, thank you so much for joining us and giving your insight about this case. We will certainly be following it, and we'll talk to you soon. Thank you.
You're welcome, Jenny. Have a good day.